Welcome to the first of two maps on heart failure, the first being for a new diagnosis. We've got links here to the NICE guidance as well as the excellent CKS on chronic heart failure and its management. The patient care information has a heart failure leaflet linking to when they need to worry and when they don't, and the local formulary gives guidance on the different types of drugs that can be used. The key messages are that the new pathway involves BNP, so let's have a look at brain natriuretic peptide, or the so-called NT-ProBNP for its full name. The key here is that if the BNP is between 400 and 2000, then they need an echocardiogram. If it's very high, you don't have to bother with an echocardiogram and you can refer to the hospital. You can manage while waiting with loop diuretics and ACEs. If the BNP is low, then they don't need an echocardiogram, but do remember that echocardiograms can also be done for other conditions. So just because the BNP comes back as negative, let's say the patient has cardiomegaly, it doesn't mean to say that you shouldn't go on to do an echocardiogram. You normally start treatment with a loop diuretic. You can refer for the community echo using the form, and the forms are linked to at the bottom of the page here. Let's just have a quick look here to the presentations. We've got links to the PDF pathways for both new and established heart failure. There's also links to the excellent presentation by Dr. Jer Seelan. And in addition, there is a good overview of heart failure, including the fact that there's a pyramid from lifestyle factors in prevention all the way through to end-stage heart failure. Finally, before we leave, a brief word on if the echo is abnormal, that what you do next depends on the severity. If it's mild, left ventricular systolic dysfunction with a clear underlying cause, it can be managed in primary care with conservative medical treatment and referral to the community heart failure team. Whereas if it's moderate or severe LVSD on the echo or significant valvular disease, refer to the hospital heart failure clinic, though there is a little bit of an overlap role for the community heart failure team. What happens is that the cardiologist may then refer to the hospital heart failure team, and they can then pass the referral on to the community heart failure team. Thanks for listening.